Much for this hearing, and I want to start by commending the public service of all of the members of the panel, Dr. Walensky, Dr. Fauci, Dr. Woodcock, and Assistant Secretary O'Connell. This is difficult work, and we appreciate your public service. In particular, I want to reiterate statements I think I've had to make before in light of Dr. Fauci's commendable public service, not just in the middle of this pandemic, throughout the pandemic, but also for decades. I think I speak for a lot of people back home and across the country that not only have confidence in your integrity, but also your work in public health, and so we're grateful for that. Let me start with a question for Dr. Walensky. Doctor, I'm quoting from a statement you made on Friday on television in the context of a question about COVID-19 deaths, and I'll quote two sentences. One is, quote, "The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities." So really, these are people who were unwell to begin with, and yes, really encouraging the news in the context of Omicron, unquote. Now this statement, and I know it was part of a broader interview, caused great concern. I know from my work as a senator for years that you and your team at CDC, whether it's the policy or the work that you do, that policy and that work are both focused on ensuring that all Americans receive the best possible treatment and protection. This is especially important for older adults and people with disabilities who may need additional supports and protections. So context is important in an interview like this. So please explain what point you were making. That's number one, the point you're making. And secondly, outline CDC's commitment to protecting older adults and people with disabilities as we continue to address the pandemic.
Senator Casey, I'm really grateful for the opportunity to explain this. And, to step back, that interview on Friday, I recently spoke to a study on the high level of protection against vaccines. It was a pre-taped interview, and much of it was cut, and that phrase was taken out of context, as you note. The study was a cohort of 1.2 million people who were vaccinated, and 36 people passed, demonstrating the remarkable effectiveness of our vaccines. But no less tragic is the 36 people who passed because of COVID-19, and that many of them had comorbidities that I've spent my career taking care of, comorbidities that just prior to coming to the CDC, we saw time and time again disproportionately impacting people with COVID-19 and the hospitals that I cared for patients. So what are we doing at CDC given the critical importance? Well, we have toolkits for COVID-19 for patients with disabilities. We have accessible materials that are available in Braille, in American Sign Language, so that people with disabilities, in easier to read and understand language, so that people with disabilities can access our materials. We have improved data collection systems on our COVID data tracker. You can track vaccination status by disability. And we've worked with states to make sure that those are reporting. And then we're funding partners and our public health partners to do more for patients with disability. And if anything, this issue on Friday has redoubled our commitment to continuing to make sure that we have access for people with disabilities. Thank you for allowing me to clarify.
Well, I appreciate that, and I appreciate the time you took to respond. I would also suggest and maybe even ask you to spend some time meeting with leaders from both the disability and aging communities to walk through what you just walked through and even expand beyond that.
We're already planning. Thank you.
Thanks very much. I want to turn now to vaccine development for children. The recent setbacks in vaccine trials for children under 5 is of great concern. So many parents are exhausted from this pandemic. So I know we can't change the outcome of the trials, but we can take steps to reassure parents that their young children will still get vaccinated as soon as possible. Dr. Fauci, Dr. Woodcock, if you could briefly talk about these trials, and anything you can tell us about speeding up the development of safe and effective vaccines for children under 5?
Thank you for that question, Senator. I'll take a quick shot at it and then pass it over to Dr. Woodcock. The situation that I believe the public needs to understand is that the trials from children from 6 months to 4 years was broken up into 2 groups. It was 6 months to 24 months, 24 months to 4 years. And in the dosage that was used, the children, the younger group, the trial met the endpoint of non-inferiority, comparing it to what would be the standard of what would be success. However, for the middle group, the 24 months to 4 year group, they did not meet that standard of non-inferiority. So because of that, it was felt that this likely will be a 3-dose vaccination for children in that group. So the trials are being done now as quickly as possible to see if they can get that data to have a uniform dose and a uniform regimen. But I'll pass it over to Dr. Woodcock.
Yeah, well, of course, I can't say a lot, but we are working very closely with the manufacturers of the vaccines on accelerating and making sure that vaccines are available for the youngest children.
Thank you very much.
Thank you. Senator Murkowski.
Thank you, Mr.